afternoon, and welcome to Health Products for You monthly webinar. We cover all respiratory topics, and today we'll be covering cystic fibrosis and the need for ongoing supplies. We welcome you here today. Just to let you know, there will be a question and answer after the presentation, and we'll be recording this, and you'll be able to access it anytime you want on our YouTube channel. So here's our little presentation. So cystic fibrosis and the ongoing need for supplies. It's a disease type that requires us to have supplies quite frequently. So just in case you don't know, cystic fibrosis is an inherited disease. It can be life-threatening, and it attacks mostly the lungs and the digestive system. It requires a medical diagnosis, and some of the symptoms include copious amounts of mucus, coughing, frequent lung infections as a result of not being able to cough for some of the patients, a fatty stool, they're not able to gain weight or keep enough sustenance to put on weight. They have very salty sweat, and they a lot of times, because of the lack of they become dehydrated very easily, so they get constipated. So these are a lot of the signs. So what common treatments do people take that have cystic fibrosis? Well, one of the main ones is nebulizer therapy with an inhaled medication. That can vary from patient to patient and physician to physician, whether or not they use bronchodilators, steroids, a combination of both. Vest therapy is very popular. I'm not sure if anybody has seen the vest, but it actually looks like a life vest that you put on, and it's measured for the patient based on their size, and it has inserted inside the vest small mechanical wheels and vibrators that shake the mucus off the lung walls, so that way the patient can cough it out more easily. Cough assist, also called an insufflator or an exsufflator or an insufflator. It actually assists the patient in coughing. They're able to put it up to their face, initiate inspiration, and it sends a nice big breath in there to help stir up that mucus and cough it out. A lot of patients are on oxygen therapy for obvious reasons. They have a lot of mucus in there. They can't transfer oxygen into the bloodstream in the lungs. A lot of patients use mucus clearing devices, or they'll use postural drainage, which is chest percussion and postural drainage, where they may be tipped into different positions to help drain that mucus out of the lungs. They also have to be on proper nutrition, because people that have cystic fibrosis don't usually absorb a lot of nutrients, so their nutrition is very important. Medications that patients are normally on: antibiotics to treat lung infections, medications that target mutations in the genes that cause cystic fibrosis. A lot of them are anti-inflammatories for the inflammation that's caused, acid reducers, and pancreatic enzymes for that for EPI. And some patients have to be on stool softeners for chronic constipation. So there's a lot of these things that the patient has to use every month, so they have to access supplies for these. So customarily, and I worked in the DME industry for over 25 years, and basically private insurers follow Medicare and Medicaid guidelines. And Medicare and Medicaid are what we call, and this particular therapy, any kind of therapy for a patient with cystic fibrosis, what we call a diagnosis-driven therapy. So the diagnosis has to justify the pieces of equipment that are supplied, or the medications that are supplied to the patient to have it covered. Guidelines include what equipment is covered based on their diagnosis, and include the amount of extra supplies they're eligible for monthly. So basically, a lot of our patients that have cystic fibrosis need to have ongoing nebulizer kits. They need extra oxygen tubing and replacement ancillary oxygen tanks. They may need extra drugs. They may need extra catheters if they're suctioning. So a lot of the guidelines based on Medicare and Medicaid either allow for a certain amount, and if anything is over that, the patient says they have to pay out of pocket for it. So customary coverage, just so everybody is aware, a nebulizer, if you were going to get it through your insurance, and your insurance is Medicare or Medicaid in the United States, they allow you to get one compressor every 5 years. The compressor, if it's paid by Medicare, is transferred ownership to you after 13 payments that Medicare makes the DME provider. And then the medications as ordered by the physician are covered because you're using them through a piece of durable medical equipment. The disposables, however, they'll only cover a certain amount during certain time periods. So they'll cover 2 disposable nebulizer kits per month and 1 non-disposable nebulizer kit every 6 months, because it's understood that you can clean that and reuse it. If you go over and above what is customary, you may have to pay out of pocket for it. The vest therapy is the same thing. After 13 months of rental through the insurance is considered, the ownership gets taken by the patient. Oxygen therapy is never like that. Oxygen therapy never gets bought out by the insurance, but there is ongoing need because that's an ongoing need for constant supplies like oxygen cannulas and oxygen tanks and service and maintenance as well with oxygen therapy. PEP devices, these are purchased by the insurance, depends on the insurance. And again, it depends on the need and the doctor's attestation, attesting to the need that the patient has to have this. Remember, if Medicare is your only provider, you do have a 20% copay. So that's where companies like ourselves can maybe help you if you can't afford to purchase it through a Medicare program, that maybe we have something that's less costly that you can get. So when it comes to Medicare and Medicaid, they have a terminology called overutilization. And what that means to them is you're using more supplies than is customarily covered for your condition. And I've seen this happen many times in durable medical equipment where a patient the customary is 30 catheters, suction catheters per month. That's 1 per day. Many people suction multiple times per day. So in order to be able to have more suction catheters or more than is customarily covered, the doctor will have to write a statement to the insurance as to why the patient needs more. At risk of infection, copious amounts of secretion due to a secondary infection, things like that. We see it a lot with diapers. It's very hard to tell a patient they can only have X amount of diapers per month when they're using them. They have to use them more than that. Like I said, suction catheters, we see it with nebulizer kits and filters for nebulizer kits. Inhaled medications, we have to obviously be careful with that they're not overutilizing, because that means that something may be wrong. And passageways valves, I've seen this happen a lot, where the insurance will cover one every quarter, but in the meantime, it may get noisy because it's dirty or something with the valve doesn't work. So that's when you have to keep in touch with your DME company, and it can be washed, just to let you know. So I know that was kind of a quick presentation, but it kind of gives you an overview on if someone has a very significant lung disease or a significant illness, that they do have to have ongoing supplies every month. Diabetics, anybody with a chronic illness has to have ongoing supplies. And a lot of durable medical equipment companies cannot provide you more than what your insurance is going to pay for unless you're willing to pay for them out of pocket. So always come to our sites, look and see if maybe you can save some money if you are going to have to pay out of pocket. We have a lot of the things that the durable medical equipment companies carry. Well, I thank you again for being here today. We look forward to seeing you next month. You can always reach out to me at Laura, Laura, at HPFY.com. And if you would like to suggest a topic that we cover respiratory wise, or something that we can cover that would be significant to you, please reach out to me or reach out to anybody at our company and let us know. We would love to talk about things that are significant to you. Thanks again for being here today.